Welcome back to another episode, and today we're tackling common sexual problems. Did you know these problems are just as much psychological as they are physical? I'm talking about erectile dysfunction and premature ejaculation. So, doctor, can you first explain what PME and ED are?
PME, the long form premature ejaculation, is basically inability to hold the ejaculation till the satisfaction of both partner happens. It has nothing related to time as stated in common man. It's related to the orgasm or the satisfaction of both partners. Secondly, the ED, erectile dysfunction, is inability to hold or maintain the erection for completing the sexual intercourse. Either the partner is not able to achieve the erection, or if he is able to achieve the erection, he is not able to maintain to complete the sexual act. That is called as erectile dysfunction.
So, who suffers from these disorders, and why is that the case?
Usually, what we see in clinical practice are the young males who are newly sexually active, newly married people who have got lot of sexual anxiety, performance anxiety usually suffer. But the second zone of people are the middle-aged males because they tend to suffer from diabetes, hypertension, cardiac disorders. Here, the nature of illness is more organic. The psychogenic component is not involved.
But how does someone know that they should go to the doctor as opposed to just suffering from this anxiety just a handful of times?
Yeah. Usually the young people tend to suffer from the anxiety, so age matters. Secondly, if the person is getting morning erections, if he is able to masturbate, if the ED is of sudden onset, that it is not the gradual onset, there is no pen or there is no curvature on erection, it's the psychogenic ED. Whereas if the person is middle age, if he is having different disorders like diabetes, cardiac problems, lipid problems, the ED is gradual in onset. Initially, there was little difficulty, which has progressed to complete erectile dysfunction. If the person is not getting even morning erections, he is not able to masturbate, the cause is more serious or organic.
And how does one get treated for these?
The treatment obviously depends on the cause. No matter if the patient is young or the old, we need to investigate to know the exact cause. So the investigations go in the lines like we need to do their fasting blood sugar, we need to do their hormone profile, we need to do the urine routine to rule out the infections. And if everything is fine, what we do is the counseling. Some relaxation techniques are explained to patient. In erectile dysfunction as well as in premature ejaculation, exercise helps a lot to hold the erection, to hold the control over the ejaculation. Cutting down the smoking also helps a lot. Relaxation exercises should be done by both partners. There are certain exercises which are specific for erectile dysfunction as well as for premature ejaculation. If the problem is still not getting solved or if the problem is organic, then there are drugs. What we use, the Viagra, most commonly used drug, over the counter drug, which people abuse, but the caution need to be taken. It's not suitable for all. Some serious side effects tend to happen if the person is taking without medical supervision. And if the problem is still not getting solved, for example, maybe Viagra for erectile dysfunction and for premature ejaculation, we give anti-anxiety drugs to control the anxiety. If the problem is still persistent and some major pathology is there, we tend to go for the injections, intravenous penile injections, and some surgeries are undertaken.
But that's for the most severe cases.
More severe cases. Most of the cases are managed with plain counseling, reassurance, and some relaxation techniques with lifestyle modification.
Great. So there you have it, viewers. Sexual anxiety is an extremely common problem amongst men that can be resolved with the doctor's good word. So you know the drill. Don't forget to subscribe to our channel and check us out on the next episode.